getting right into it. With your experience, how would you describe the healthcare technology landscape in the Middle East? And what unique opportunities or challenges do you see there compared to other parts of the world?
So the Middle East is undergoing rapid digital transformations with countries like Saudi Arabia, where I'm from, heavily investing in healthcare technology as part of our 2030. Actually, if you look at the whole GCC strait, every one of them has their own future vision for healthcare. The region's focus on innovation has opened up a lot of exciting opportunities for AI adoption, telemedicine expansion, data-driven care models, value-based care, as well as personalized medicine. Of course, challenges remain. Data fragmentation across healthcare systems. A lot of us are establishing our health information exchanges, the need for stronger governance frameworks, and varying levels of digital literacy amongst healthcare workers slow progress. And by the way, the patients are sometimes more caught up than our workforce. To ensure that solutions are scalable, secure, and user-friendly is going to be very critical.
Thank you very much. And you're absolutely right. Sometimes the patients nudge us off the fence and you do something about the technology.
Yeah.
So absolutely well said. You've had a fantastic career in healthcare technology, Tamara. You've helped, you've led major digital transformations. From your learnings and experience, what would you say are the three most important factors for successfully implementing new technologies in healthcare systems?
So I would say it needs to start at the top with leadership commitment. So digital transformation must be championed from the highest level in the organization, not only the CEO, but at the board level. And this ensures that the leaders are actively engaged into it. And then, of course, from the top to the bottom, so you also need end user involvement. So clinicians and staff must be engaged very early on to ensure that the solutions are intuitive and aligned with real world needs. What problem are we trying to solve? And then we also need a very good, robust change management, right? Because digital adoption requires clear communication, ongoing training, and support to overcome resistance, or sometimes it's not knowing how to deal with these tools. And I cannot emphasize training as one of the most important things to ensure success in your rollout. Also, data-driven decisions are very important. So a strong data governance is needed to ensure that the insights are accurate, actionable, and impactful.
Absolutely. And I remember when we were embarking on our EHR rollout, and when I was working in the Middle East as well, I still remember you said, training is where you will win or lose the battle. Make sure you get people trained. So that's a very, very valid point. And I've seen it firsthand.
And I'd like to, and also, sorry to interrupt you, but also workflow training, right? So it's not training on the AI itself, but training it within the workflow, right? So not only just showing somebody how something works, but how to use that thing. That's the important kind of training that's needed.
Thank you very much, Tamara. And lastly, what do you see as most promising areas for AI to impact healthcare delivery in Saudi and the broader Middle East region?
So I see AI holding immense promise in preventative care. And we talk about this prevention before intervention, right? Chronic disease management and remote patient monitoring. With also Saudi Arabia's investment in smart hospital and integrated digital ecosystems, AI will revolutionize triage systems, streamline diagnoses, and expand access to care, particularly in underserved areas. And I think it's going to democratize the way we deliver care. And not only those underserved areas, but beyond the walls of clinics and hospitals to homes and work and all these places where health is actually happening. And not only for those, but also we can utilize AI-driven decision support. For example, in emergency medicine departments where we can prioritize critical cases faster, improving outcomes. Additionally, of course, we said this before, AI's role in personalized medicine will unlock tailored treatment plans, improving both safety as well as efficacy of those treatments because they're personalized to each person's genetic makeup.
Absolutely. Thank you very much, Tamara. Just summing up what we just discussed, I think Middle East is a region unique to itself in terms of the workforce, and also it always surprises me. And the mobile penetration going on to the upskilling of your workforce. The mobile penetration in the Middle East is above 95%, which tells you a lot in terms of the capability of the workforce there in adopting new technology. And I think the right use case in the right clinical work setting, baked with the safeguards, the policies, and the cautions that we need, are the next best steps. So thanking you again, Tamara, for your time and for your insights. I loved the chat. Thank you very much.
Thank you, Rahul, for this conversation. It's been amazing, and looking forward to the future.